My name is David Richards. I'm an orthopedic surgeon here at Gilbert Clinic, Western Kentucky Orthopaedics. The patient population I see really covers the whole spectrum. In fact, today I've seen patients as young as 8 years old and as old as 75. I see a lot of age-related wear and tear type problems, be it arthritis, rotator cuff tears, overuse type injuries. I see a lot of fractures. A lot of that's on call and that sort of thing. A fair amount of sports injuries, both organized sports from the area high schools and the like, and some of the just weekend warrior type things. Yeah, shoulder surgery is something I do a lot of, not exclusively, but I do a lot of. Just it's an interest of mine, and it has sort of evolved that way. Probably the most common shoulder problems we see that rise to the level of needing surgery are rotator cuff injuries and arthritic conditions. There are some others that are not quite as prevalent. Dislocations or instability, particularly in an athletic group or in a younger working age group, those can be problematic and require surgery sometimes. But rotator cuff tears, which is something that most everybody's heard that term, are very common, particularly from middle age on. And then degenerative conditions. And that seems to be, if you look in our literature statistically, something that's increasing in prevalence. I think as people live longer, more active, and we have improved ways of managing those problems, the increase in shoulder arthroplasty or joint replacement has expanded dramatically in the last decade. And it's people seeking a better quality of life, wanting to stay active, and us having better things to offer, in that arena. Rotator cuff surgery, the toughest part of that whole condition is the recovery process. It's lengthy. If you do heavy physical work, it may be 4 to 6 months before you can get back to it. If you do lighter work, office work, usually you can get back fairly quickly, maybe with a sling for a period of time, but you're still fairly restricted with your lifting, pushing, and pulling for a while. The other category, say joint replacement or arthroplasty for shoulders, actually progresses a little bit quicker. It's a little counterintuitive. You wouldn't think that an entire joint replacement would proceed faster than a cuff repair, but it does. Again, you've got some time in a sling, probably 4 to 6 to 8 weeks, depending on what we do. Yeah, what to expect on your day of surgery? Everyone's a little bit nervous. That's normal because it's just an unknown. It's really not unpleasant at all. I've had 2 operations myself, and I'm an insider. I know everything that goes on, and I was a little nervous too, even though I knew everything that was going to happen. And number one, anesthesia is very pleasant. Very rarely are people really sick or uncomfortable afterwards. And just trust that your surgeon and the team are going to take good care of you. I mean, we take the business very seriously. We try to keep, the conversation light. We try to keep the mood up. But don't be fooled into thinking that we're not being vigilant or paying close attention to you and everything we're doing. We're just trying to make it look easy and make it, comfortable for you. We hate surprises, and we do everything we can to avoid that. Why come see us at Western Kentucky Orthopaedics? Number one, I think we're a great group of docs, number one. And that goes beyond the clinical skills, the character and the people I work with. I'm very blessed. It's a great group of folks. I think if you have any musculoskeletal complaint, whether or not you think it's orthopedic related or not, we can sort that out for you pretty fast. And in the event that it's not, we can get you to a specialist that would be most appropriate, be it neurology or neurosurgery, for instance, or something that might overlap. I think we have really, really sharp physicians here with good clinical skills, and they're really concerned about that patient relationship, getting you well. And that oftentimes is not a surgical process. Oftentimes it's physical therapy or some other things that might get you, where we want without having to resort to surgery. I get up early. I still study before some operations, even though I've done them a lot of times. I'll review things, review anatomy, review things, just because you want everything to be perfect. That's kind of the standard we all hold ourselves to. And I come to work every day with an attitude of, how can I help? It's really a lot of fun to work here, not just because of the people, but just the nature of, who we care for. It's pretty gratifying. At the end of the day, you go home and you feel like, I did something that was worthwhile today. Somebody benefited from it, and I guess that keeps you going.